Now we have a few minutes left, and what I would like to do is over the last week or two in the United States, we've had now concerns over the Delta variant. And this is the new term for the Indian variant or the double mutation variant. And this variant has a E484Q type of a mutation. So it is similar to the South African Brazilian variant. And this has just started to emerge in the United States. And unfortunately, we do not have a robust system of genomic sequencing. So we cannot detect community spread, but we are sequencing cases that are unusual, such as reinfections or post-vaccination infections. And from this data, we are seeing a large upsurge in this variant. Now, at the same time, we have pretty much relaxed our social distancing, masking, and a lot of our techniques and strategies to prevent the pandemic. And we're also seeing upsurges in respiratory syncytial viruses and colds, which does not bode well for the spread of this variant. This variant, as you know, does evade immunity. You have to have at least the 2 vaccination doses of the mRNA vaccines. A single dose will not give you adequate protection. And unfortunately, in the United States, although we have probably more vaccines in the world, we have about half of our population that's very vaccine hesitant and may not want to take them. And on top of that, they tend to clump or live together in rural areas and in certain regions of the United States, which leaves those regions highly susceptible to this variant. So right now, we are starting to have advisories even going out this morning from the White House and health officials warning of this variant. Maybe we still need to continue our social distancing and some of the strategies that we're doing in the past. So this is one of the problems that we're having in the United States. Unfortunately, I think we still have a lot to do to prepare for pandemics and our response to pandemics in the US. I'd like to also comment a little bit on the mutants and, again, the strains of the viruses. We talked a little bit about that before, but there's 2 very good websites I think the audience may want to go to and take note of. One is called nextstrain.org, and this is a website that you can see all the different strains and the mutations. And I was looking at this website back in June 2020 when we didn't have hardly anybody talking about mutations, saying the virus didn't mutate. And lo and behold, this website back in June was showing mutations all over the place. And to me, that was really a red flag. The other very good website is outbreak.info. Outbreak.info has information on the variants, the amount and percentage of these variants, and the genomic sequencing per countries. With the United States, it's actually even state-specific data. That website's run by Scripps Research that uses WHO data, and it has funding from both the NIH and the CDC. And so that's outbreak.info. So if you really do want to track the spread of the Delta variant, that is a good site to be on. And I should also add that when you talk about the mutations of the Delta variant, the South African variant, and the Brazilian variant, they're all similar. And many think that this is an example of convergent evolution, where you have totally different organisms, if a virus is an organism, that acquire the same characteristics. And because of that, a lot of people think that the virus may be reaching a fitness plateau, that once we get over this one surge with the Delta variant, that this may be our last hurdle. At least that's what a lot of us are hoping. And luckily, our vaccines, if they're taken, are very effective. And I think other nations are now having to deal with the Delta variant, which is, as I said, the Indian double mutation variant. The naming of the variants actually is quite interesting. We tend to stay away from naming them by countries because that can politicize the virus. And instead, now we've gone to the Greek alphabet. The Alpha variant being the UK, Beta variant, South African, the Gamma variant, the Brazilian, and then the Delta variant, the Indian variant. As a little vignette on why this is done, you could, look at the Spanish flu. Spanish flu started in Kansas, United States, was then spread to Europe. And because of World War I, both the French, English, and the Americans tended not to recognize that we had the infection and downplayed the amount of those infected in the case numbers. Spain, on the other hand, was honest about it, and their monarch came down with the flu and thus publicized it, and they got named with the Spanish flu. So that's one of the reasons why I think the WHO went to the variant type of naming of beta, delta, gamma. And it's kind of interesting, but during pandemics, all countries have a history of tending to mitigate the severity of the disease and the case counts and also the death counts. That's just not what occurs within the pandemic that we're currently dealing with. And there also tends to be a lot of political, really kind of reshuffling. You can say it's unrest, but nevertheless, sometimes societies realign themselves with the pressures that the pandemic imposes.